Welcome back to Med School Mind Maps. Today I want to talk about brain bleeds. And I've split up the brain bleeds into the three most common types. We have epidural hematoma, subdural hematoma, and subarachnoid hemorrhages. I want to start at epidural hematomas. This one is one of the more common types of brain bleeds seen in athletes or children or people who are active, and it occurs through direct trauma to the side of the skull, specifically the temporal bone. So what happens is you have an artery. You have an artery that runs across that supplies the meninges including the dura mater here. And the dura mater is just the covering of the cerebral hemispheres. It's the first layer. And this artery runs on the outside of the dura between the skull. And what happens when you have a skull fracture is a piece of the bone can lacerate the middle meningeal artery, which again runs across this area. Because it's an artery and has a much higher pressure than a vein, that blood can rapidly increasing intracranial pressure and compressing this brain structures right here. This could lead to multiple side effects, including loss of consciousness, nausea, vomiting, dizziness. But I want to go through how you identify it on a CT scan. So we're going to go back to the epidural part of the mind map here, and we're going to look at the CT scan here. So you have a coronal section here of the brain, a sagittal section of the brain here, and it presents as a biconcave lens shaped. So the dura is firmly attached at the suture line. So the suture line is here, and the suture line is here. So whenever you're having this bleeding, it's not going to cross that suture line since the dura is blocking it at those points. So you're going to see blood right here, and this is how you identify this on a CT scan. From it not crossing the suture line. And we can differentiate it from other brain bleeds here in a moment. But I want to go to the clinical history here. So the patient's going to present with a history of trauma to the side of the head in most cases, followed by loss of consciousness, which can present up to minutes or hours, and they're going to have periods of lucid. Periods. Now, as the blood rushes over into between the skull and the dura, you're going to have rapid deterioration because it's going to increase intracranial pressure very acutely. So that's something that's very important to remember, and it's also very important to treat this as this is a neurosurgical emergency. So, as you must suspect, the neurosurgeon must remove this hematoma, which is just a bleed outside of a vessel, as soon as possible. Okay, I want to continue on to talk about subdural hematomas. So subdural hematomas, as opposed to epidural hematomas, are bleeds beneath the dura and the arachnoid mater, which is the second layer of the meninges. So we can look at a little bit of a cross-section here. So you have skull, you have subdural space, you have dura here. So this is the dura mater here. So an epidural hematoma, again, is above this area, but a subdural hematoma is below this area. And what causes a subdural hematoma is rupture of bridging veins. Now, I want to go over what a bridging vein is. So the brain, of course, has to figure out a way to get rid of the blood inside, or it has to figure out a way to get the blood back out of the brain. So, of course, we have veins, and bridging veins are just areas that kind of the blood feeds through, as well as some CSF, and it goes through the pia mater back up into the subdural space, up into the dural space or epidural space. And what can happen is whenever you have an acceleration, deceleration injury, say in a car accident, or say you hit your head falling backwards, these veins can actually rupture. Okay, so when these veins rupture, what can happen is you can have a much slower bleed than a epidural hematoma because, of course, veins have much lower pressure than arteries. So this can obviously present a little more chronically, but still it's very important to treat. So again, people who are at risk of this are older patients, and this is because their brain can somewhat atrophy and get smaller over time, and this causes these bridging veins to stretch. And when they stretch, they become weaker and more prone to rupture. Another classic risk factor is in infancy. The veins are very fragile, haven't fully formed, haven't fully gotten that elasticity that they have in adults. So whenever, say, a baby is shaken, this can cause rupture of the bridging veins, and this is known as shaken baby syndrome. All right, so I want to look at a CT scan now of a subdural hematoma. And remember how we said an epidural hematoma can cross the suture lines? Well, because this is beneath the dura, it's beneath where that dura is fixed to these suture lines. So it can present as crescent shaped, and it also can cross the dura. So it looks like it doesn't, or cross the suture line, I mean. So it looks like you can't really see it crossing the suture line here, but still this is a very common image of a CT scan of someone with a subdural hematoma. All right, so I want to move to the third and final brain bleed that we're going to discuss, and this is a subarachnoid hemorrhage. So if you can remember, we had this image here, and it's not shown here, but I'm going to illustrate it on this image anyway. So we know you have the dura mater. Beneath the dura, you have the arachnoid mater, which just means spider mother. It's a web-like structure of meninges that CSF runs through. And beneath the arachnoid mater, you have the pia mater. And the pia mater is very closely fixated to the brain. Okay, it's just the last covering of meninges of the brain. So let's go back to subarachnoid hemorrhage here. And that's very important because, of course, whenever you have a subarachnoid hemorrhage, that blood can very easily diffuse throughout the entire brain, increasing intracranial pressure very acutely. Now, the causes of a subarachnoid hemorrhage are classified under two. We have spontaneous causes and caused, or just general living your life causes, I guess. So let's first talk about spontaneous. So this is what you very much classically can assume as a rupture of a saccular or berry aneurysm. Now, what an aneurysm is the stretching of an artery due to either high blood pressure or weakening of that vessel due to conditions such as Marfan's or Ehlers-Danlos. There's various other causes. We'll go through this in another video, but what you can see is that when this artery or this aneurysm gets bigger, it can rupture, and this is what's known as a spontaneous subarachnoid hemorrhage. All right. Now, the other causes are most commonly head trauma. Now, this can be either a motor vehicle accident, like we saw in epidural, or serious fall, also as we saw in epidural. So it's very important to distinguish the clinical presentation so you can differentiate between the two. Now, this is also a life-threatening emergent condition, and we're going to go over the pathophys now, which is just one little line of it, and we've already done it. It's just bleeding into the subarachnoid space. Now, how do subarachnoid hemorrhages present? So they're most classically going to present as a sudden, severe thunderclap headache. Patient will say, "This is the worst headache of my life," and then they will lose consciousness. And you can see some gross images of a subarachnoid hemorrhage here. We got bleeding. This is above the pia mater, so it's not going to go into the cells itself. It's still going to be above, but you can still see all this bleeding. And I want to bring your attention here. So this is the circle of Willis, and I know it's not a very good image, but if you can recall, there's bifurcations here. So here's the basilar artery. It's going to bifurcate in the posterior communicating artery here. And what you can see is most commonly subarachnoid hemorrhage or aneurysms occur at these bifurcation points. So we'll go through all these bifurcation points in another video, but that's just something to keep in mind. Alrighty. And it looks like that is it. So please like and subscribe this video. If you have any comments, please feel free to comment and tell me how I can make these videos better. And I hope this was helpful.